The big question is, as we get closer and closer to the release of the vaccine, is do we have the resources to be able to get it out there?
Yes, we're in the process of planning for COVID vaccine. We've got meetings set up with a variety of partners to discuss prioritization because initially the vaccine is going to be in limited supply. So we're going to figure out who do we give it to first. There's a lot of discussion about where to store the vaccine. Early indications are that this vaccine may need to be frozen up to like -70, -80 degrees.
Wow.
So some of our stuff, the refrigerators and freezers we have can store some of that, but we're looking at buying more. Too early to say what quantity we're going to get. There is a letter that went out from federal HHS to the state governors about getting ready for COVID vaccine. So we're waiting on state guidance on what needs to happen at the local level. But we're preparing as much as we can, trying to get all our ducks in a row and get things going.
Obviously, the county is going to be distributing. What about my pediatrician or my general practitioner, urgent care? Where should I go to get the shot?
So for COVID vaccine, initially indications are that it is going to come through governmental channels, right? I mean, it may go to the state and then get distributed to the local health departments. There's also talk about direct federal distribution to nursing homes and some other entities. It's not very clear at this point what that route will be. Eventually, it will become available to the private market, like, okay, pediatricians or private doctors can access it. If you recall, during H1N1, it was the same sort of process. The vaccine was in limited supply, so it had to be sort of given out with some thought on who gets it and how to distribute that. And the best way was to engage local and state public health departments in that effort.
The test is now available at the grocery store. What's the advantage of going to the county or the grocery store?
So it's just a convenience. I mean, if you are out to the grocery store for a pickup of your groceries, certainly if you don't have any issues with the payment of the test, it's convenient. You can do it at your own time, at your own house. County currently, and all our other partners, we have City of Fort Worth, City of Arlington, Texas Department of Emergency Management. We all have testing available. And of course, there's costs related to it. It's about the same, between $100 and $140, depends on what kind of test is being used. And it's covered by the CARES Act. So if people have insurance, we will certainly collect that information and share it with the lab company. That way, the lab company can bill a third-party insurance. And the CARES Act dollars that have been allocated to all of us then go a longer way to cover those folks that don't have insurance. But otherwise, I mean, we're not charging anybody for the test. If you go to a grocery store, buy an off-the-shelf kit, if you will, if it's available that way, then you're paying out of pocket. If you have a prescription of some sort for that test, you may get covered under your insurance. So worth exploring if there's ways to have that test covered. So that's the only real difference. We have tests that we do at our drive-through locations that are self-administered. So there's really not a whole lot of a difference than buying it off a grocery store and self-administering a test.
There was originally some concern about the saliva test not being as accurate as the nasal swab. Is that still the case?
No, I mean, the data that we're seeing on the saliva test is pretty comparable to what we saw with the nasal swab. The key difference remains how well the test sample is collected. There are a variety of different places where you can collect the sample. The most hard to reach is the back of your nose or the back of your throat. And the only thing that is there is either your own secretion through your nose, or when you go to the back of the throat, it's the food and the drinks that you eat. And again, it's way back there, so usually it's untouched. But it's hard to get a sample from there. That's usually the best sample that you're going to find. So you need a trained professional to get a nasal swab all the way back there, or an oral pharyngeal swab all the way back in the back of your throat to get a good sample. If that is collected correctly, it is supposed to be more accurate. Otherwise, if you just have a nasal swab, which is the outer part of the nose, or a spit test in a saliva, or there's a cheek swab, you rub the inside of your cheek, those are equally accurate. It's just how well the sample is collected. And there are some things that matter. If you eat food or drink water or any other drink before your test, or chew gum, it has the ability to lower the viral load in your mouth. So it can impact the test results. So that's why there are instructions that go with it that don't do those things at least half hour before you do your test, whether it's a cheek swab or a saliva test. On the nose swab, because you're collecting from the outer nose, the concentration of the virus is not as high as it would be in the back of the nose. So there's a process. Blow your nose before you have a sample collected, because that way you're blowing the virus out to your nose to have the sample collected. So those are some of the techniques to get those samples equally good. And again, for all samples, when they get to the lab, they only work well if the collection was done right. And that's the key. At the collection site, if the collection is done correctly, then on the back end, they're equally good, regardless of where they were collected from.
So if I go to get tested and I find out that my spouse has COVID, who needs to quarantine in the house? Does it just my spouse, or is it everybody in the house?
So certainly the spouse who's positive needs to stay home, and any close family members would be considered exposed. So whoever's in the household, another spouse, kids, grandparents, whoever else lives with you, they should all quarantine for 14 days. And people who are not ill have a longer quarantine period, because they're the ones exposed and may develop the virus over the 14 days. Person who's already ill, from the day they got ill, they should stay at home isolated for about 10 days. And the idea being, in about 10 days, their symptoms should be improving. If they had any fever, that fever should be broken, and then they're considered recovered. So that 10-day and 14-day difference is a little confusing for folks, but people who are just exposed and are not ill should stay home for 14 days so that they don't become an asymptomatic carrier, or they don't start having mild symptoms that they miss while they're out in the public. And that's why we ask folks to stay home for 14 days.